When I think about medications, like a lot of things, I take a middle ground approach. Medications aren't for everyone, but they are for some people. And when we can, I think it's best to look at medications as a stopgap. They're going to help us do the work in therapy, in getting motivated to change habits and behaviors and thoughts. It's like they should go together, medication and therapy. For some mental illnesses, medications are required for long term stabilization because the illness is more pervasive. I don't believe that medications always open the door for the enemy. I do think that there are some medications that are more addictive. And so I think we have to be more cautious with those. I don't think they necessarily open the door for the enemy. I think they're, in a lot of ways, common grace to us. A lot of things I think are common grace from God to us. Can we overuse or abuse that common grace? Absolutely. But that doesn't mean that Christians should not take medications. Because if you need a medication to function, whether it's for your diabetes or your thyroid disorder or your blood pressure or any other ailment that's physical, would we look at someone and say, oh, you shouldn't need that medication? If you just had more faith, you wouldn't have diabetes. We don't do that. That's not realistic. But we look at people with mental illness and say, you shouldn't need that medication if you just had more faith in God. That's not realistic. There are chemical imbalances, hormonal imbalances that require medications. I'm taking progesterone right now because I don't have any. And it's real important to a lot of the functions of my body. So, am I inviting the enemy by taking this medication? I don't think so. I think I'm actually defeating the enemy because I'm doing something about my issues. And I'm not just accepting that I'm going to struggle. I'm accepting that I'm going to struggle, but there's something I can do about it. And I'm moving toward healing and wholeness. And that's what Christ has for us.